In this video, I'm going to try to outline the most common causes of neck pain and how you can treat it. The first thing you want to identify if the patient has a neck pain or shoulder pain. Shoulder pain and neck pain problems overlap. You need to know if the origin of the pain is the cervical spine or if the shoulder itself is the origin of the pain. Does the patient's symptoms improve by shoulder abduction and placing the hand over the head? Then the pain is cervical spine origin. Shoulder abduction test, lifting the arm above the head, usually relieves the symptoms because it decreases tension on the affected nerve. Is the pain more when you move the shoulder? Then the shoulder itself is the source of the pain. An important cause of neck pain is disc herniation. The patient will complain of numbness, paresthesia, radiculopathy, which is shooting pain that radiates from the neck to the arm. So the patient will have unilateral arm pain, numbness, tingling in a specific dermatome in the hand, as you see here in this diagram, and weakness in a specific muscle group. In cervical radiculopathy, the pain is sudden and goes to the arm. Radiculopathy occurs due to compression of the nerve root, either by a disc herniation or by arthritis that narrows the foramen. Cervical disc herniation occurs most frequently at the level of C6, C7, and it will affect the C7 nerve root. It can also occur at C5, C6, and in this case, it will affect the C6 nerve root. How do you test for cervical spine disc herniation? You test the motor, the sensory, and the reflexes. This is how you test the motor strength of the nerve roots from C5 to T1. This is how you test the sensation, as you see here in this diagram. This is how you test the reflexes, as you can see here in this diagram. The Sperling test for cervical spine radiculopathy. What is the Sperling test? The Sperling test is considered positive when neck extension and rotation towards the painful side reproduces symptoms in the ipsilateral arm. The natural history of cervical radiculopathy is favorable, with resolution of the symptoms in most cases. In cervical radiculopathy, patient will have 70 to 80% successful outcome after 2 to 3 months with conservative treatment. How do you really treat a cervical disc herniation? So you're going to start non-surgical treatment first. We will use anti-inflammatory medication, isometric exercises, physiotherapy, muscle relaxant. Then get an MRI if the symptoms does not improve after 6 weeks of conservative treatment. The MRI result should be correlated with the